How do India stand from a healthcare and tech standpoint in comparison to West?
So, when I decided that I wanted to, spend my time in healthcare, right, I started looking things everywhere. And of course, US being one of the leading spender in healthcare. So,
Right.
so I observed and, tried to understand that a lot more. Some interesting facts, right? So, US is the largest economy. Of the largest economy is the largest spender in healthcare. They spend like 17% of their overall budget, GDP, in healthcare.
Wow.
Yeah.
Wow.
So in respect to that, we in India spend. I mean, now it is increasing. It's close to 4% now.
Right.
Right. So still, but the challenge of coordination still looms very large even in US. Okay, and if you go ahead and see that, is it really as good as the money being spent? I think I can say with a lot of confidence the answer is no. Okay, and if you look, try to understand why. Right.
Sure.
So I think in 1990 onwards, the digitization journey kind of started over there. Right. So everything is digitized. But digitized doesn't mean, it just means that something was on paper now has moved to computers, right? But that doesn't create the impact,
Okay.
right? Like we have been saying, it is a long value chain. Like a lot of engagement is required and all of that. Now that is kind of missing, still missing over there. Another fact, the largest cause of hospital-related deaths is hospital-acquired infection, even in US. So what I'm trying to say basically is, I think at least in healthcare, in many ways I have observed that the money spent is not directly proportional to basically the impact in that. Of course, I mean, it helps. So still a long way to go, and the biggest challenge even in US today is care coordination.
Right.
Right. When it comes to India, right, I mean, we are still in an early stage where the digitization is basically getting started, right? But looking at everything that's happening, even in India, I'm fairly confident that India, just like in telecom, and we may start late, but we'll catch up very, very fast.
Yeah, that's
I think still a lot to be done. Like the government has launched a few programs like ABDM, and it's amazing. But the implementation of that is still kind of not up to mark.
okay.
In terms of adoption, I would say, I mean, government is trying to figure out ways to do it. But still, efforts needs to be put in over there. I mean, some innovation from the government side is required over there to make it really either enhance or accelerate the adoption of that.
Right.
But I do see that the people are demanding now, and that's where which is pushing even the private hospitals to kind of accelerate their game on the digital side.
Right.
So all I can tell you is that while we always knew that the doctors are the best, even in US, if you're an Indian hand of Indian doctors, you can be fairly confident that he'll do a good job, and the same is in India as well. So. I think we do have a best of the doctors in the country. We do have, good hospitals over there and over here in India. The only thing I can ask for is, I mean, if the coordination can be done better, then we'll see, much more impact than what we have seen in the past.
Right. Right.